So today what we are gonna discuss is about P drugs. Okay? So you guys have any idea about what is P drug? किसी को कुछ आइडिया है? थोड़ा मोड़ा छोटा मोटा कुछ? No idea. So the meaning of P drug is personalized drug. ठीक है? Now what is personalized drug? It's the drug of your choice. ठीक है? For example, I prefer a drug. You may prefer another. ठीक है? So the P drug for me is A and the P drug for you is B. ठीक है? Now that's why the name personalized drug. ठीक है? यहाँ तक clear? Now how will you take your P drug? ठीक है? ऐसा तो नहीं है कि you will choose heparin and say yeah this is my P drug and you will give it to everyone. ठीक है ना? So before selecting a P drug, you need to set up 4 criteria. ठीक है? One is tolerability, efficacy, safety, and cost effectiveness. ठीक है? Tolerability, safety, efficacy, and cost. ठीक है? चलो. If I go more further, you will get to know that, for example, one patient came to you with a disease. ठीक है? You have diagnosed the disease. Then what you will do? You will give him, let's say, any antibiotic. ठीक है? After giving the antibiotic, let's say you have given ceftriaxone. Ever heard of the name ceftriaxone? सुना है ceftriaxone का नाम? नहीं सुना? सुना? सुना कि नहीं सुना? हाँ या ना बोलो यार. नहीं सुना. Cephalosporin groups. सुना? तो in cephalosporin groups there are 5 class of drugs. ठीक है? Class 1, 2, 3, 4, 5. ठीक है? Now let's say you gave ceftriaxone to a patient. ठीक है? As an antibiotic. Whereas she may give cefixime. ठीक है? It's on the same group but different class. ठीक है? Now for her maybe her P drug is cefixime. That's why she gave cefixime. But for you, your P drug is ceftriaxone. Now based on the criteria, now as you have given the patient a lot of number of patients ceftriaxone earlier, you will be known about the side effects, about the effects of the drug. ठीक है? अगर 50 पेशेंट आया, let's say you have prescribed at least 30. ठीक है? 30 पेशेंट को तुमने ceftriaxone या कोई भी एक कॉमन ड्रग दिए हो तुम. ठीक है? Now you will know the demerits and merits of the drug, right? Now that's why you are giving the drug based on the effectiveness of the drug. ठीक है? This is the concept of P drug, personalized drug, so that you don't have to search and you don't have to bother again and again for the same type of disease or same disease. समझ में आया? या फिर से रिपीट करूं? समझ में आया या रिपीट करूं? हाँ? Okay. For example, you are sitting in an OPD. ठीक है? Now there are many drugs in the market. ठीक है? A single drug can be present within you but with different brand names. ठीक है? Now you can't memorize each and everything. ठीक है ना? So maybe you will remember hardly 50 to 60 names. ठीक है? For example, if you get fever, you will take paracetamol. ठीक है, I can give P650, I can give Dolo 650, I can give any other drug, any pyresic I can give, right? But you will take paracetamol. ठीक है, now you have remembered the drug. तो तुम्हारा अगर पेशेंट आया तो तुम पैरासीटामोल दोगे. ठीक है, तो now you have remembered the drug so that you don't have to go again and again to see for the similar kind of drug to give in a same type of situation. समझ में आया? ये फिर से बोलो. चलो, let's see. P drugs are the drugs you have chosen to prescribe regularly and with whom you have become familiar. ठीक है? They are your drugs of choice for given indications. Now, it also includes the dosage form, dosage schedule and duration of treatment. ठीक है? Now, what is dosage form? You know that, right? Exam में आया था ना? How will you give in puffs, tablets, syrups? ठीक है? Dosage form में रहेगा. Schedule, schedule मतलब कितना बार लेना है. दिन में एक बार ओडी करके लेना है, बीडी करके लेना है, टीडीएस या क्यूएडी. ठीक है, 1 2 3 4 कितने बार करके एक ड्रग लेना है. एंड ड्यूरेशन ऑफ ट्रीटमेंट फॉर हाउ मेनी डेज और हाउ मेनी मंथ्स he or she the patient has to take the drug. ठीक है. Now see, as I have told, the drug enable you to avoid the repeated searches for a good drug in a daily practice. ठीक है, हर रोज तलाशना नहीं होता है. There are patients waiting, you have to give the drug. ठीक है, so you prescribe. So as you use your P drugs regularly, you will get to know the benefits and side effects also. ठीक है. So now the thing is the P drugs will differ from country to country and even between individual to individual. From you, her, everybody has a different option. ठीक है, and you of course you all will be right. ठीक है. Now, because of the varying availability, cost and national formulas. ठीक है. चलो. See, most of the doctors use 40 to 60 drugs routinely. It is therefore useful to make your own selection from this list and to make the selection in a rational way. Now see, as I have told, the choice to give a P drug is safety, tolerability, efficacy and price. ठीक है, ये 4 पॉइंट याद रखना है. सेफ्टी, टॉलरेबिलिटी, एफिकेसी एंड प्राइस. ठीक है. Now, a P drug is a drug that is ready for action. It's not like कि अच्छा ठीक है मैंने दिया. If the drug doesn't work, the patient will come after 3 days and say, sir, पैर में तो swelling था, वो घटा नहीं. Please change the drug. No, you have to give the drug and it has to make some actions. ठीक है? It should be such type of drug. Now, process of choosing is the defining the diagnosis, set therapeutic objective, make inventory of the effective group of drugs, create an effective group and choose a P drug. Now, इसका मतलब क्या होता है? Now, how will you define the diagnosis? Now, before you define the diagnosis, you must know the pathophysiology behind the illness. ठीक है? If you know the pathophysiology, then you can give the drug and you will know the drug at which site the drug is acting upon. ठीक है? Now, let's say you could not figure out the pathophysiology or the particular point of illness. ठीक है? Let's say the patient came, sir, पेट में भी दर्द हो रहा है, सिर में भी दर्द हो रहा है, हाथ में भी दर्द हो रहा है, पैर में भी दर्द हो रहा है. ठीक है? Now you gave him, let's say, an aceclofenac or diclofenac sodium. ठीक है? After which the patient said, सर सिर का दर्द तो चला गया, हाथ पैर का भी लगभग चला ही गया, पर पेट का दर्द अभी भी है. So what had you done? You have given a drug for the symptomatic relief of the patient. ठीक है. Now this is symptomatic relief because you could not figure out the diagnosis, so you have given a drug that can resolve most of the thing but not everything. ठीक है. So you are giving something for the symptomatic relief of the patient. If the pathophysiology is not known to you. Now therapeutic objective क्या है? After you make the diagnosis, let's say you make the diagnosis that a patient is suffering from hypertension. ठीक है. Let's assume a patient is suffering from hypertension. You have given the diagnosis, and your therapeutic objective is to make him normotensive. ठीक है. Now, to make him normotensive, you will give a drug and advise the patient to continue taking it. ठीक है. And modify his lifestyles. ठीक है. Now, you prescribe a drug like, let's say, the patient is having BP of, let's say, 200 systolic and diastolic is, let's say, 120. Now you give the patient a very low dose drug and expect the patient to recover. Okay? Now what you will do, you will give him something in the mid range or in high range. High range in the sense high dosage drug. Okay? Let's say after diagnosing the patient of hypertension, let's say hypertensive emergency where the systolic and diastolic is way too high, then you won't give, like, let's say amlodipine 2.5, which is a very low dose drug. Okay. The patient may get a slight reduction of BP, but not much. Okay. Then again you have to redo or increase the dosage. Okay. So you have to set a therapeutic objective. No, I'll start from amlodipine 5 first, and then I'll also give him let's say propranolol. Let's lower his BP, then I can maintain the BP. बाद में एक ड्रग ओमिट कर देंगे, बट फर्स्ट ऑफ ऑल आई हैव टू लोअर द बीपी फर्स्ट. ठीक है. आर यू गेटिंग माई पॉइंट और शैल आई रिपीट अगेन? कुछ तो बोलो, हाँ ना कुछ बोलो. रिपीट करो या समझ में आया? Now choose an effective group. Now what's the effective group? Now at the beginning I have said, let's say the example of ceftriaxone, right? The cephalosporin group. There are 5 classes I have told. So let's say you have chosen class 2 and class 3. Okay? So this will be your group, cephalosporin group, and the class. Okay? Now choose a P drug. Among the 2 classes, we'll choose a single drug which will be your P drug, personal drug. ठीक है. Now, how will you define the diagnosis? Is to do you should study the pathophysiology of the disease. The more you know about this, the easier it is to choose a P drug. ठीक है. Now, see the 3 diseases: hypertension, diabetes mellitus, and tonsillitis. Now, when you are about to give the treatment for these diseases, you should consider about long-term benefits of the patient. Okay? It's not like you will give today and the disease will end tomorrow. The person has to take for a very long period of time. So you have to, while prescribing a drug, you should also consider the long-term benefit for this patient. Okay? And now, how will you maintain this long-term benefit? The 4 criteria: safety, efficacy, tolerability, and the major thing is cost. Okay? Got it? Now, this is the chart which may come at your exam. ठीक है. Now, ये क्या है? See, name of the P group. Let's say you have selected 3 drugs. ठीक है. 2 to 3 drugs, you will write the name 1, 2, 3, efficacy, safety, suitability and cost. ठीक है, फिर यहाँ पे टोटल करना है and you will get your result, and then it's easier for you to get your PDF. ठीक है. Now, to be an effective drug has to reach a minimum plasma concentration and have a easy dosage schedule as per kinetic profile. Kinetics are compared on the basis of ADME. Now, you guys can tell what is ADME and excretion. So kinetics should be compared, and whenever you are giving a drug, as you have studied, it should reach a minimum plasma concentration level. Okay. Now these are some case criteria for you. Paro and tell me the diagnosis. Read the question and tell me the diagnosis. Sure? Okay. Any other? Any other answer? Any other answer? Sorry. क्या होगा इसका डायग्नोसिस? Duodenal ulcer and anything? और कोई? ये गैस्ट्रिक अल्सर होगा या पेप्टिक अल्सर होगा? अच्छा, व्हाट्स द डिफरेंस बिटवीन गैस्ट्रिक अल्सर एंड duodenal अल्सर? Sorry? And gastric ulcer? Okay. And isn't there any difference between the sides? Okay. Chalo. Now it's a peptic ulcer disease. ठीक है? So I think you have done in your patho how peptic ulcer happens or occurs. H. pylori, फिर okay, and due to NSAIDs. Okay. So what does H. pylori do to your stomach or duodenum? Increase the production of HCl. How? No. See, H. pylori when get attached to your stomach lining of epithelium, then it produces an enzyme. नाम पता है इसका? नाम नहीं पता? यूरिएज. ठीक है? UREASE, यूरिएज enzyme. Now when this urease is formed, तब तुम्हारा हो like whatever you said, it increases the production of acid. ठीक है? Now this is the pathophysiology between the H. pylori. And NSAID क्या करता है? NSAID क्या करता है? Inhibits prostaglandin, which in result cause decreased production of bicarbonates and mucus. So it causes the breakage in the epithelial लाइनिंग, ठीक है. Am I clear? Now this is the treatment. See, when you will have a patient who came to you in your hospital having hematemesis, that is puking of blood along with stomach pain, what will you do? And after you have diagnosed the patient, you will give him first PPI, ठीक है. इंजेक्टेबल देना है पहले, PPI, then an antibiotic, then why I am giving iron folic acid? Okay, if you have read the question, it shows decreased hemoglobin. See, CBP shows decreased hemoglobin, ठीक है. So I have given iron and folic acid tablet, vitamin B complex and tranexamic acid also. So what is the function of tranexamic acid? Tranexamic acid नहीं पता. Tranexamic acid is used to stop bleeding at any condition, ठीक है. And HP kit, इसको याद रखना है. HP kit, it's H pylori kit, ठीक है. It contains omeprazole, tinidazole and amoxicillin. HP kit contains omeprazole, tinidazole and amoxicillin, ठीक है. चलो. Now see, this is the drugs which you will give. Ceftriaxone, pantoprazole, tranexamic acid, B complex, IFA and sucralfate to protect ulcer from the injury, and methylcobalamin, vitamin tablets, ठीक है. Now which drugs are new to you? यहाँ पे okay. So see, tranexamic is a drug. जब तुम ब्लड का चैप्टर पढ़ोगे तब आएगा ये. इज ए टाइप ऑफ ड्रग विच इज गिवन टू प्रिवेंट द ब्लड लॉस, ठीक है. एंड सुक्रालफेट इज अनदर which gives a lining over the mucosa, ठीक है, so that the eroded mucosa can get repaired by itself and shall not get disrupted again by the release of acids, ठीक है. This is the role of sucralfate and tranexamic acid is to stop bleeding, ठीक है. Clear? Now next study. एक बार देख लो question and give me the diagnosis. क्या होगा? चलो, much more simplified. क्या होगा? नहीं पता. Breathlessness with expectorations? No idea. See, the diagnosis is asthma, ठीक है. Acute exacerbation of asthma. Question पढ़ा था ना? क्या था question? Okay. So you guys know how asthma occurs? नहीं पढ़ा? Complete नहीं हुआ? Physiology, pathology. Okay, let's say your respiratory system or the respiratory lining is attacked by eosinophils. which mechanism will get activated, TH2 or TH4? Two. Q? Sorry? Acute inflammation. Yeah. TH2 will get activated. Now, as you know, eosinophils and along with TH2 has property of constriction. वो जहाँ भी जाएगा constrict ही करेगा, ठीक है? It will constrict your airway, so it will cause breathlessness, which will lead to exacerbation of asthma. समझ में आया? चलो. So these are the drugs which you will give in any patient of asthma. Theophylline, amoxicillin clavulanic acid, Montelukast levocetirizine, ipratropium bromide, some vitamins and folic acid and cefixime. Now, can you guys tell, ये जो पहला drug है theophylline, which class or group of drug is theophylline? नहीं पढ़ा? Okay. चलो ये बता दो at least. You guys take it. Montelukast. No, it's not antihistaminic. नहीं पता? Okay. Montelukast is Leukotriene receptor antagonist. Leukotriene receptor antagonist, ठीक है? And theophylline falls under the category of Methylxanthine, ठीक है? Methylxanthine. So these are the drugs which you will prescribe to a patient having acute asthma attacks, ठीक है? Now, last case is chronic mild asthma. So, do you know what is chronic mild asthma? Chronic भी है, mild भी है. Okay. Whenever you get this question, chronic mild, read it like persistent mild asthma, ठीक है? Now, what is persistent? Persistence means you will get the attack of asthma twice in a week, but it should not be repeated, ठीक है? Let's say today is Tuesday. If the patient gets an attack on Tuesday, the patient will have another attack, let's say on Thursday or Friday, ठीक है? Not Tuesday के बाद Wednesday को भी हो गया, ठीक है? See, this is chronic mild asthma. It's persistent more than two days in a week, ठीक है? And it will cause awakening at night due to cough, ठीक है? और breathlessness. समझ में आया? Sure? Okay. See, now the treatment, for symptomatic treatment, you will give bronchodilation, and for pathological treatment, you will prevent the release of mediators, suppression of inflammation, prevention of antibody-antigen reaction, and antagonist of release of mediators. ठीक है? These are the drugs which you will give in chronic mild asthma और persistent asthma, ठीक है? देख लो. Now, persistent mild asthma में do not forget to tell or write this corticosteroid, budesonide, ठीक है? It's क्या बोलते हैं इसको? ब्रह्मास्त्र है ना? ब्रह्मास्त्र. It's the ब्रह्मास्त्र, budesonide. You have to give corticosteroid, LABA, SABA. These all do their work, but ultimately it's the corticosteroids which maintains it. ठीक है? Got it? चलो, thank you.